Hi, everybody. Dr. Kelsey here from KML Academy, where we are anchored in science, guided by intuition, and always personalized for your path. Okay, so what am I doing? Why am I in the same outfit as I was in another video? And the reason why is I'm actually wrapping up my day, and the questions about EMDR have come up at least 3 or 4 times today. So I thought, before I wrap it up and it gets too dark out, I'm going to do 10 minutes or less. I'm going to explain what EMDR is. I'm going to at least try anyway. It's a lot to unpack in 10 minutes, but we're going to try. So EMDR stands for eye movement, EM, the D is desensitization, and the R is reprocessing. And this particular treatment, you know how I am about those evidence-based treatments. I am a scientist practitioner model. It is evidence-based. It's been around for a very long time. It came up by Francine Shapiro, and it's been around since like the 80s, as I would say more recently started picking up a lot of traction with new providers wanting to know what this is and how to use it. So it is evidence-based for the treatment of trauma. It has a lot of studies reinforcing it in terms of being used for PTSD, for veterans, and all sorts of things. I will also say you don't necessarily have to have a firm PTSD diagnosis for it to potentially be something that is effective and helpful as an adjunct treatment for you. Other providers might disagree with me, but that's my personal thought process around that. I personally feel that if somebody has an underlying core belief of I don't matter, I'm not good enough, whether it is from a shock trauma, relational trauma, anything that might have happened that has kind of led to that and it's fairly solidified, EMDR can be one of those techniques, just one amongst many, that can be quite helpful to sort of loosen that up and shift it a little bit. And you hear me say that kind of word like loosen it up. Well, what I mean is that a lot of times people will describe trauma as almost getting stuck in an area of the brain and you just can't move it through. Or people will talk about there being like a filing system within the brain, and this particular set of memories, one memory or many, depending on what the trauma might be, just isn't fitting with the others. And so it doesn't have a file to go into, and it seems to kind of get us, whether it be through flashbacks or whatever it might be, panic attacks, things like that. So EMDR is just one of the many trauma treatments that can be done to help ease that brain and sort of take away a little bit of the emotional charge that might come along with a particular memory or set of memories or experiences a person has been through. And it can be quite helpful in assisting to do that. There are a lot of theories about why this might work. Anywhere from the theories saying that there's the two separate hemispheres of the brain, left and right, and the corpus callosum down the center that holds those two almost separate and that they don't communicate a lot. So there's a theory that it helps shift things through the midline of the brain or crosses over the midline. You might have heard that terminology before. That's one of the theories or working theories around it. Another working theory around it is that it just might make somebody a little bit more mindful and aware of what's happening in the moment, because it is so quick. You're directed to think about if there's any thoughts, images, body sensations, feelings, or anything popping up in the moment. And personally, I find for my clients, whether it be clients with eating disorders or other clients that might have highly developed defenses, anxious clients, people that kind of spend a lot of time up in their head, it really is quite helpful for just easing and taking down those defenses a little bit so that we can get in there and just see what's happening without rationalization or intellectualization or those types of things. It can be really, really helpful for that. And then there's also the thought of a theory called the working memory theory, which is one of the more thought about ones or supported ones today. And this just means that it reduces the vividness or the emotional intensity of a memory, which could make it easier to process. And that holding that traumatic memory in your mind while trying to perform a task like eye movements taxes your working memory. So there's that idea too. I mean, I don't think anyone has totally determined the exact why. It's a lot of theories. My clients say, though, they don't really care about the why. In this circumstance, I might tend to agree with them that as a practitioner, it's nice to see that there's a positive outcome. We don't always need to know exactly why that outcome is happening. There is a lot of research to support this particular treatment, and I will link some of it down below. There was a recent 2020 meta-analysis related to it that does support that EMDR is quite helpful for PTSD, those experiencing PTSD, and the effect size was quite large. Now, don't get me wrong, there's also a lot of questions about it. So it's not a perfect science. There are a lot of questions about maybe saying it's not necessarily any more helpful than any other trauma treatment, and I'll include that as well. But it is one of many options for you, and I think it's important to always know what our options are so you can be well informed, regardless of whatever route you go. Now, what is it exactly? Of course, if you want to do EMDR, you got to get in front of somebody who can actually take you through it. But I'll tell you some of the basics. The eye movement is just that. It's eye movements back and forth. And it's what we call bilateral stimulation. Again, bilateral, we're stimulating both sides of the brain. Now, you can do it through eye movements, which is the typical traditional way that Shapiro came up with it. However, it can be done also with buzzers or tappers, where we typically are maybe crossing over, and those buzzers are stimulating, again, both sides of the brain. You're probably going to be asked to come up with a memory or an image or something that has a charge to it. In my personal experience, sometimes I don't even do the most deep trauma experience with somebody. I might start with just something that has happened that's got moderate intensity. Recently in their week, maybe you took out the trash and all of a sudden you started crying and you didn't know why. Well, that particular thing, if something's being triggered, it's usually an indication it's getting at an underneath core belief there. I don't matter, I'm not good enough. Something like that is being triggered in you. And that's the emotional charge that we want to work on and the reprocessing that we want to work on. It's not to say that you're going to go through life and never have a feeling again. Again, that's not normal or healthy either. It's normal to have feelings in distress, right? But it's not normal to have it take over your life. And that's what trauma survivors often describe, is that it feels like it takes over their lives completely and they don't feel like they have any control over it. So we want to decrease that kind of a charge, emotional charge that it has. And we want to reprocess it. How would the experience day to day, or that thing that you have charged with, feel a little different if the only thing that happened was you believed you were good enough or you mattered? And it might really change the way that you see that particular situation. So that's kind of the thing that we're working on with EMDR. It's working much below the surface. Traditional CBT, nothing wrong with that. I believe in that too. Can often be thought of as kind of hanging out here in the mind. And it can also get underneath, but you got to work to get there. So we want to stay away from the automatic thoughts and go to that deeper core beliefs that are quite far down there, that are then feeding all this stuff, including the automatic thoughts. And that's the idea, again, behind EMDR. Let me also say, always do it with a certified professional. Do not try to do it on your own. Have somebody with you. This is a serious treatment, and make sure the person knows what they're doing and that they're certified. They've gone through the trainings for it. At KML, we do have folks that are certified in EMDR. They know what they're doing, and they can walk you through this and guide you through this evidence-based treatment in a way that you deserve, that we know is going to be safe and effective for you. Last thing I will leave you with, guys, is that trauma treatment should always be about handing back the power to the client, right? When we've gone through trauma, our power has been taken away. So if any treatment is not handing you back that power, it just simply might not be the right treatment for you. EMDR is one of those ones where you really are in the driver's seat. You're not necessarily just along for the ride. You're there as a participant. You're consciously aware of what's happening, and you can tell your practitioner at any point in time if you need to stop and go to your safe space or take a break or whatever it might be. And that is what trauma-informed care is all about, handing back the power to you. It's not the only way to get it done. There are lots of different ways that you can feel empowered and move through this trauma. So if EMDR does not work for you, do not feel you can't get help. You can. I want you to remember, do not use this as a substitute for your therapy. Only ever use this as an adjunct and as something to guide you and give you more information to be your best and most optimized self. Until we meet again, I want to remind you that you matter, you deserve, and you're enough. Take care, guys.